Hello and welcome to the BloodStream podcast, a show serving the greater bleeding disorders community, brought to you by Believe Limited and BloodStream Media and made possible thanks to our presenting sponsor, Takeda. I am your, I almost said patriot advocate and host. I still got that July 4th mindset going, but last I checked, I'm your patient advocate and host, Patrick James Lynch.
And I am your healthcare advocate, nonprofit nerd, and your other host, Amy Board, reminding you to please speak with, oh no!
This is my fault. No, I did this.
Oh no, it's Patrick's fault. Reminding you to speak with a healthcare professional before making any treatment decisions.
On today's apparently patriotic show. Who knew?
Incredible.
Nathan Mermilliod joins for a conversation about Hemophilia B in partnership with Zebra for Care.
And we're also joined by hematologist Dr. Stephen Fine. He is the founder of a company called Heme on Call, which is pioneering greater access to telemedicine services for patients with bleeding disorders.
We have got all of that and more on today's show. Happy 250th America. Welcome to BloodStream.
Listeners, as always, thank you for joining us today. And if you like what you hear, if you also are patriotic and I'm wearing kind of a patriotic, vest today, maybe it's a thing. Please share this episode with your friends, with your family on social media. And if you haven't already, subscribe to the BloodStream podcast wherever you get those podcasts.
I also want to remind you, dear listeners, that the BloodStream podcast is indeed made possible thanks to our presenting sponsor, Takeda. Yep, that's right, Takeda. Takeda's got this website, bleedingdisorders.com, where you can learn all about Takeda's resources for and commitment to the bleeding disorders community. Amy, did you know that Takeda believes in a world free of bleeds?
I did. I did know that.
Oh. Well, they're also working harder than ever to offer more programs and support to help patients throughout their treatment journey, wherever on that journey they may be.
Oh, okay. Thank you.
Just wanted you to know that too. And you can learn more by simply visiting bleedingdisorders.com. One more time, because we need it this time, bleedingdisorders.com. And for their ongoing support of the BloodStream podcast, I would just like to say thanks, Takeda.
Thanks, Takeda.
Whew. Wow, that was more difficult than it usually is, Amy.
Wow. I'm shocked that our producer Keith didn't come in here and was like, you guys are done. You guys are out. You're done.
He knows it could get worse.
He knows it could get worse. Actually, one of the things I wanted to bring up is a whole bunch of I saw this LinkedIn post from Dr. Nathan Connell, who's a hematologist in our community. We've had him on the show multiple times. And he came out with some new data. And I'm like afraid to go into it because I'm like, I'm probably going to butcher this, but we're going to do it.
You're going to crush it.
We're going to do it. Dr. Connell actually posted this a couple days ago, and there's a new study out about hemophilia B carriers and pregnancy, which I think is really fantastic. And so I just want to read this for you, kind of an overview, high level, and then we'll link this study in the program notes. So if you're nerdy, you can kind of get in there. Dr. Connell says, is it time to rethink what we tell hemophilia B carriers about pregnancy? For years, guidelines have stated that factor IX levels do not rise during pregnancy in hemophilia B carriers, unlike factor VIII in hemophilia A carriers. This has driven more conservative management, such as earlier planning for obviously factor, all of those things. But guidance actually was based on some data from like 30 carriers across 10 publications, many of which were isolated case reports, which I think is interesting. But it looks like factor IX levels did significantly rise during pregnancy. Even in women with mild hemophilia B, levels increased meaningfully. Every carrier.
Well, just to clarify, Amy, sorry to jump in,
no.
but it seems as though that original guidance was based on data from 30 carriers across 10 publications, many of which were isolated case reports. The data that you're now citing looks like it's from an Irish study that had 49 hemophilia B carriers across 87 pregnancies, the largest cohort to date. So a more robust study has triggered this updated information.
Thank you for that clarification. I knew I would butcher it. I knew it.
You just wanted to make me look good because you're a fantastic co-host.
Yeah, you're right. It was all about you. So anyway, why does any of this matter? And Dr. Connell says we may have been overcorrecting. Some of these women were not likely told that they could, or some of these women were likely told that they could not have an epidural, or they were given factor concentrate that they may not have needed. And this study suggests that with proper third trimester level monitoring, many hemophilia B carriers, especially those with mild hemophilia, can be managed less conservatively than current guidelines recommend. He does make a note here that this doesn't change the picture for carriers with very low baseline levels, where the rise still may be insufficient. But for meaningful proportion of carriers, it opens the door to safer, more patient-centered care. So he says, bottom line, check the levels, don't assume they will rise, and now the data will say otherwise. And so we're going to link that study in the show notes so you guys can check it out. But I just thought it was interesting. Here we are talking about women with hemophilia and all this new data coming out. So I thought it was interesting. This is great. Hemophilia B.
Yeah, it is interesting. And it creates a reference point for a woman who is carrying to go to her doctor and say, look, this is the most updated data. This is what the current guidance is. This is how I would like my care to be administered. Without this kind of data, it's more difficult to advocate in these ways. But when we have data like this, it's like going into battle with some actual, sword or something.
Yeah.
Going into battle?
Yeah.
I guess that's good. Advocacy can be like a battle, right?
It is. Oh, no, advocacy is 100% a battle.
So,
brutal.
Bring a sword.
Bring a sword. It's another tool in your toolbox. It's like nunchucks.
You mentioned that this will be linked in the program notes. So if people have any questions or want to dig into it for themselves, they can follow the link in the program notes. And we thank Dr. Connell/Cannell for his continued advocacy and work in the community.
Thank you.
All right, Nathan. So we've known Nathan for a long time. I'm going to give a little bit of an intro in the actual interview setup, but I just wanted to quickly highlight, we met Nathan through Hemophilia the Musical, which we executed about 8 years ago, and he has since gone on to do amazing things within the bleeding disorders community, and now as a young, not yet professional, but student with sights on his professional career. I don't want to step on the interview. Let's just get into it. This is my conversation with Nathan, made possible thanks to Zebra for Care. Here we go. Okay, joining me now is a fellow bleeding disorder community member, a friend, someone I've known for 8 or 9 years, a participant of Hemophilia the Musical and the Breaking Through Workshop, a winner of a Teen Impact Award, a recipient of the Adam S. Lynch Memorial Scholarship, and just an all-around cool fellow Californian. I'm joined today by fellow community member, Nathan Mermilliod. Hey, Nathan, how are you?
I'm great. Thank you so much for that introduction. I feel so important. I feel so involved. I think one thing you left out is I'm starting medical school.
So that's exactly right.
I'm trying to become a hematologist oncologist. So in the future, and I'm starting med school this fall.
So let's talk about that. When and how did you decide med school was the path for you?
Man, I think that there were many moments throughout my life that kind of led me to it. I didn't make the final decision to be pre-med or apply to med school until about sophomore year of college. Right now I'm 24. I took 2 gap years from between undergrad and med school. So that was about 4 years ago, maybe 5, that I truly set myself at this goal, start off on achieving my dream to be a doctor. But I have severe hemophilia B, and, growing up, obviously I had so many experiences, so many injuries, so many bleeds, so many doctor's visits, and my doctors are absolutely incredible, were incredible for my youth. I know that is not a solo sentiment to say that most hemophiliacs, would consider their hematologist their hero. In a lot of ways, I certainly did. And so I wanted to grow up to be just like them. I've had multiple And there are certain aspects of being involved in the bleeding disorders community, being someone with a bleeding disorder myself, that drew me to medicine. And yeah, get more into that later.
That's amazing. And did you always know that you wanted to be a hematologist, or was it more, I know I want to be a doctor, or was it always, because I see these hematologists, that's the path I want to replicate?
Yeah. Well, I feel like, having hemophilia, I wanted to be a doctor with hemophilia, a hematologist with hemophilia, so that I could kind of add this layer of comfort, this layer of trust to my patients, potentially with bleeding disorders. But there also is something that I loved about just the doctor, just doctors in general. The fact that, and in my experience, a doctor can, really support you in so many ways than just your health. When I was a kid, I actually like drew family portraits, when as a kid you do that. And I would include my doctor, Dr. Solly, in those family portraits because he was so important to me, so meaningful in my life that he just held my hand through everything. If I wanted to do something like, do a different activity, start baseball, start doing playing more on the playground at school, he was there to, have that understanding, have that foundation for those things. So a doctor can be so much more than, just diagnosis, treatment, etc. And yes, in my experience, I've dealt a lot with hematologists, but there's so many amazing doctors out there, and I thought that is like, something that I really want to aspire to.
That's very cool. I'm curious your take on something, Nathan. I've been talking this summer with some people about the role of a second opinion.
Yeah.
And I've highlighted that for me, for example, before I got my ankle fusions on my 2 ankles, I had a second opinion with an orthopedic surgeon outside of my hemophilia treatment center so I could get additional input on what are you seeing in these images? What do you think? And for me, that second opinion was extremely validating and helped me feel more confident in the choice that I was already leaning toward.
Yeah.
But it really gave me the confidence I needed to make a full decision. In your experience, has a second opinion ever proven to be particularly helpful for you?
Yeah, absolutely. I mean, I've gone to external specialists from like my hemophilia treatment center for all sorts of things. I had some heart issues earlier when I was a teenager. I had some fainting episodes. And I always got that base opinion from my primary care and from my hematologist. Well, they kind of intersected at times. I had a primary care physician who was a hematologist oncologist. So I was very lucky for that.
It's handy.
Yeah, it was. But yeah, I mean, it's really important to use the medical system that we have in its full extent. I think patients, especially, people who don't go to the doctor very often, don't understand like how comprehensive your care team actually is. People with bleeding disorders obviously have a dedicated care team for hemophilia or other bleeding disorders with the hemophilia treatment centers. And people don't understand. We have a social worker. We have, we have a care manager. We have tons of dedicated health professionals that are there to work with you, in every aspect of your life, in every aspect of every decision that you make in regards to your health. How is this going to affect my social life? How is this going to affect my schooling? How is this going to affect my work? And so gauging every opinion that you have is so important, and utilize your resources.
You mentioned the different members of the care team. Growing up, I had a particular connection with the social worker at my hemophilia treatment center because I liked that she talked to me about school and activities outside of school and summer camp. Did you have any particular connections with one member of the team or another growing up?
Man. Well,
Obviously, you're a hematologist if you're
yes,
including
my
hematologists and family
hematologist, right? I'm
portraits.
trying to think outside of that. Obviously, my doctor was the commander, the leader of all the teams. But of course, I've had great care otherwise. Unfortunately, my care team has rotated quite a bit because I had to change my hemophilia treatment center when I was about 14 years old. Um, and I've also moved to a few different locations throughout Southern California. So I don't have a particular person that would stand out among the other members of my care team, but I've actually shadowed quite a bit of physicians, and I shadowed a clinical psychologist at a hemophilia treatment center one time. And so that was a really interesting experience. He was able to, ask some patients about certain things that are going on in their life, the big questions, right? Everything that could be going on really importantly, like are they having any problems with people in their life that are hurting them, etc., right? Those big questions, but also the very small minute details. What is your friend group like? Things like that, and those sorts of questions can really get at what's really going on with their health. I definitely love the approach. I love the way that he was able to ask questions and getting at something else that he might not actually be directly asking about, but that adds to the overall what their understanding of this patient is. And so, yeah, your social worker, your clinical psychologist, they are so there to help you. I just really can't emphasize enough how important the care team is. So use them and talk to them, be open up to them. When I shadowed, I saw there was definitely some patients who were doing the bare minimum on the answers, yes or no. Elaborate, expand as much as you can. Something I was taught from a very early age is to advocate for yourself in the doctor's office. And advocating for yourself means giving the whole picture, like every piece of information that you think is relevant, that you think could be important to your doctor, to your clinical psychologist. Like I really think that is super important to do. Yeah.
So, Nathan, you brought up shadowing, and I'm curious to know about other experiences that were particularly surprising or unexpected to you as it relates to shadowing.
Well, when you're pre-med, you try to get as much clinical experience as possible, including shadowing. It's a really big deal to be able to understand what the healthcare system is like, what it's like to be a doctor. You won't understand fully what it's like, but you can kind of get there. And when you're applying to med schools want to know that you understand what you're getting yourself into, right? So I did a lot of shadowing. I was really fortunate to be able to shadow my own hematologist and members of the team at the HTC that I'm actually a part of. So I was able to really see what it's like to care for people with a bleeding disorder. And I especially was grateful to shadow both pediatric and adult hematologists. So I got the full kind of scope of what a practice would actually look like in my life. I remember the first time I went to my hemophilia treatment center to shadow, I went out the door that day, I was like, oh my gosh, I need to be doing this, and very lucky to have that kind of experience, because I know a lot of people don't fully know what they want to do in life, and until you see it happening right in front of you. So I would say you know, it was so valuable to actually not being the patient, seeing other patients, seeing a very broad perspective of diagnosis within bleeding disorders, and see like what is that this actually look like, what's the scope. I learned there's a lot more, about women with bleeding disorders, a lot more to do with their care, than I initially knew growing up. There's so much that women with bleeding disorders have to deal with, and so many aspects of it that physicians have to consider. We even did a whole entire um, it was like some sort of big initiative to bring in multiple specialties from the care team, gynecologist, hematologist, you have the scribe, you have the social worker, you have the care manager, all in one table virtually, go rapid fire for like 6 patients at a time. And I thought that experiment was really cool. We got to see and help women with bleeding disorders, navigate their life. So that was probably standout.
Neat. I'm wondering, as you mentioned this, I spoke at the top about some of the participation that you had in the community growing up, some of the programs where we interacted over the years. How do you think being involved in the community helped shape your choice to embark on a career in medicine?
Yeah, I love this question. Um, I think the community completely solidified everything I'd already been searching for and going for, aspiring to, in terms of medicine. As you introduced me, I did do Hemophilia the musical. I was a recipient of Team Impact Awards, but I don't know if you remember, but I also presented a Team Impact Award one time. So that was a lot of fun. I think those and other things with Believe Limited here and there. I think those experiences were, taught me individually a lot about empowerment of people with bleeding disorders. Hemophilia the musical was all about that. I mean, okay, I was in the original cast in 2018. It was like one of the best experiences of my life, for sure. We got to go to New York. For those of people listening who may be unfamiliar, although I doubt that there is many, it's 25 teens flying to New York to perform a off-Broadway musical called Hemophilia the Musical. It was all original songs, an entire original show, workshops, everything for a few days, and we had to rehearse and perform a show. And in the show, there was songs about the good times, and the down times about living with a bleeding disorder, the times where, it's hard, it's really hard. And I've had my share of difficult bleeds and injuries throughout my life. But there was also so much about empowerment and just being yourself. This is a part of you, acceptance of that. We sang Feeling Free in Love and Life. That was one of the big lyrics. So that sort of thing always stuck with me. And from there's a lot of connections between that messaging and patient care. As a patient myself, like I said, I had to learn how to advocate for myself. But before you can do that, before you can talk to other people about your disorder, you have to be comfortable with your disorder. You have to be educated on your disorder, and you have to be accepting of that is a part of you, and that this is unapologetically me, right? And that's all what Hemophilia the Musical was about. All about that creation of the community. And when you have that community, when you have people that that are like you, that you have your same or similar bleeding disorders, that comes a lot easier because it's like you're not alone. And so when you tell other people, like in class, in school, whatever, I have hemophilia, right? And it comes up a lot. That's probably one of the biggest things is, you need to explain your bleeding disorder to people over and over and over. And you have to tell, like as a boy, I had to tell my friends, hey, it's my lowest factor day. I can't play kickball on the asphalt. I can't go hiking, and if they didn't already have that understanding, that background knowledge of, oh, he has hemophilia, he has certain limitations, but it's completely normal. This is something about it. They wouldn't probably have been as accepting of me as a friend. They might have been a little bit more judgmental. And I saw that so many times, right? And so when you are a doctor, you have to consider that sort of thing. You have to consider the patient, how this is going to affect their life in those social ways, in those self, actualization ways, who, understanding who you are with as it relates to your disorder. And it can't just be like sign off, okay, here's your factor product, this is the schedule, this is the regimen, right? It has to be more of, okay, let's talk to you about, this is who you are, this is what you have, and this is how you explain it to people. These are resources, this is a community that you can be a part of that has people in it that are dealing with the same thing as you. And then that adds so much to, the value of the healthcare team. It adds so much to the patient's ability to live a normal life, like I luckily have been able to. And so that intersection of empowerment and community is so important to treat patients the way they fully need to be, especially with not just hemophilia, not just bleeding disorders. Anyone with a chronic disorder, anyone with a rare disorder has to be dealing with these things. There's much more I could talk about. Hemophilia, the musical, Teen Impact Awards obviously were great. I also been very lucky to be involved with NBDF, National Bleeding Disorders Foundation, in many different ways. And I think that experience led me to medicine in a little bit different way, in that it opened my eyes to how much is out there in the bleeding disorders community. I have my Hemophilia Foundation of Southern California here. I have my own things and my own injuries and my own knowledge about hemophilia. But going in nationally volunteering, I did NYLI. It's a program that I highly recommend to anybody listening who knows anybody that is within the age groups of young adults that are eligible for this thing, because it is an incredible program. National Youth Leadership Institute, where I was able to speak and advocate on a national level at Washington Days, at Bleeding Disorders Conference, and many other things, and learn how to advocate in a lot of different ways. And being in the community, seeing the national community, seeing the people that come to these conferences, seeing the people that joined NYLI, people like me, I saw the vast, ridiculous scope of bleeding disorders in terms of the disparity of outcomes, the disparity of, how, not disparity, but the plethora of amount of people affected by bleeding disorders. And there is so much in our community that needs to change, needs to be, needs to be looked at with a proper eye. There's research, there's policy that needs to be created and done to help certain groups, people with ultra rare disorders, women, bleeding disorders. There needs to be education and resources for minority groups all throughout the country, and people who are in rural areas. There's literally so much that work that needs to be done. And I saw that, and that was one of my biggest inspirations to become a doctor, because as a doctor, you are that authority figure. You are that person in leadership roles a lot of the time, especially within this community. Someone who, you know, there's lots of people other than doctors that can be leaders and authority figures in the bleeding disorders community, but obviously doctors have the highest level of expertise regarding the disorders themselves. And doctors oftentimes have the ability to have the biggest weight to their voice, with regards to policy, with regards to advocacy and research. And so I felt that in order to make a really big impact in my own community, I already love medicine, I already love biology and things like that. I thought being a doctor is one of the best ways to, lift the patient voice, lift underserved voices within this community. So being in the community exposed me to all that. It also empowered me in a lot of ways. I grew up in theater, did Hemophilia the musical, and, hopefully all of that I'll be able to take into a medical practice, and it will help my approach with patients so that I can give the best care possible and set patients up for a healthy, normal life, those living with chronic disorders.
That's tremendous. That's a great message, Nathan. And I have no doubt that you're going to be an excellent doctor. You're coming from the right place. You care, and you're doing all the right stuff, just in short. With the few minutes we have remaining, you're welcome. I want to ask you about transitions, because it occurs to me, as you mentioned, you're 24, that in the last 6-7 years, right, you've graduated high school, you've turned into an adult, and now I've proceeded into young adulthood. You had your pre-med experience, you're now going into med school. You mentioned moving between a couple states. You've had a lot of transition in your life in the last 6-7 years, it sounds like. And transitions when managing a bleeding disorder can be difficult. Do you have any words of advice or tips or tricks for people who might be going through some kind of transition and are struggling with some element of managing their hemophilia or bleeding disorder?
Yeah, absolutely. I feel like every time I go somewhere new, meet a bunch of new people, and I haven't moved states, but I've moved to different places within Southern California, which is a big place. I have to reintroduce myself, reintroduce my bleeding disorder to the people that need to know. And it kind of goes back to being comfortable being able to share that information, being able to keep yourself safe by keeping others in the know. The people that are going to be around you the most, your closest classmates, your closest co-workers. A lot of the time, there can be an accident or something that happens, and some person in that environment, supervisor or whatever, needs to know about your bleeding disorder. And so I think that was the biggest thing with the transition, is being able to kind of set that up in case something happens. Being able to set up a new HTC potentially as well. Being able to set up a new care team and find those resources. There's hemophilia foundations pretty much everywhere in the US, almost covering anywhere that you can go, any place that you move new to. And those will connect you to tons of resources, the HCC, to every person that you need to know in the community. But it's up to you, it's up to me to tell the people in my life that don't understand what that is, about hemophilia. So, and that will protect me pretty much the most. Keeping up with your product, your medication, figuring out, a new address to send, your stuff to. That's something that I'm managing right now, with my new address here in LA. And, it's a little bit different. I'm very worried about if the package is going to come on time, if it's going to go to the right place. Oh my gosh, if the Amazon worker or the UPS worker doesn't know how to get to my door in this apartment complex that I'm in right now, it could be stolen. I don't even want to think about that. So there's a lot of things to consider and set up. I just do everything that you can to make your environment as safe as possible, and then live in it. Do everything with your life that you can. I'm here going to med school, and I couldn't be happier. I couldn't be happier to be where I am. So long as my school, my close classmates know that I have this disorder. I'm living in a safe place where I have access to treatment. And those are the biggest things.
Well, Nathan, maybe after your first semester, we can reconnect and get some updates from you. I know you're going to be busy these next few years, but we'll try to steal some time from you here and there.
Yeah, I'd love to. I'm sure I'll have the time. Yes, I will be busy, but I'm always happy to share my experience here. And I definitely want to, because there are many, many people in the bleeding disorders community, many young people that are considering going into medicine, whether they want to be a hematologist or not. And I've seen it, and in NYLI, I actually saw there was like more than half of our cohort were pre-med. And that was unbelievable for me to see, because, there's something about having hemophilia or a bleeding disorder that really draws you to medicine. And I know for a lot of people, they have that dream, at least when they're younger. So I want to kind of be that, that voice that says, hey, you can do it, you can achieve that dream. And not only that, but you're going to make a great doctor, because people with bleeding disorders, have a very unique experience in life. There are not many people becoming doctors that have a chronic disorder, that have any sort of condition. You'd be surprised. It seems like a common route to medicine, but I don't think that it is. And we need more doctors that understand the lived experience of patients. When I was a kid, I did see one hematologist who actually had, I believe, mild or moderate hemophilia, like myself. It just completely changes the game. When your doctor has actually lived through something that you're experiencing. So I want people to understand, like, this is a path that is very viable for people with hemophilia or bleeding disorders. You can do this, and, it's not going to be that crazy hard. Being a doctor is hard, but it is very possible. So I would love to share my experience with that.
Well, we'll have you back on then in some months to get an update. Nathan Mermilliod, thanks for spending time with me today. It's good to see you.
Absolutely. Thanks, Patrick.
Well, thank you, Nathan, for that conversation. I always appreciate catching up with my friend Nathan, who, I should add, we met up in Los Angeles not too long ago, and he gave me a very lovely little gift, which included a picture of the two of us from NBDF a few years back, framed, and it's now hanging out in my office. So thank you for that gift, Nathan.
I love that.
Yeah.
That's
He's a
great.
thoughtful fella.
That makes
in
my
case
day.
you couldn't tell, he's a thoughtful fella.
Comes from good parents. I like his parents. All right, y'all. Our next guest is a hematologist who's working to boost access to telemedicine appointments for patients with bleeding disorders. Dr. Stephen Fine is the founder of Heme on Call, and he sat down with Patrick for a comprehensive discussion about the changing landscape of virtual care and the importance of second opinions. So enjoy this conversation.
As treatment options in hemophilia B continue to expand, many patients find themselves facing an unfamiliar challenge, not a lack of choices, but an abundance of them. Dr. Stephen Fine is a Johns Hopkins and Duke trained board certified hematologist. He's the founder of Heme on Call and leader of benign hematology services at Amplify MD, where he works with patients from across the country seeking specialized care and second opinions for bleeding disorders and other blood conditions. Because his practice is built around telemedicine, Dr. Fine has a unique view into the questions patients are asking, the decisions they're weighing, and the information they're seeking as they navigate today's rapidly evolving treatment landscape. In this conversation, we'll explore the value of second opinions, shared decision making, and what patients can do to feel more confident when facing important healthcare choices. You've heard us talk about Zebra for Care before on BloodStream. Dr. Fine is a major part of that platform, and he joins me now. Dr. Fine, welcome and thank you for being here on the BloodStream podcast.
Thank you for having me.
So we gave a little bit of your background there in that introduction, but before we jump into the world of hemophilia B and the work you're doing today, what would you like audience to know about your background and hematology practice in general?
Yeah, I started as a benign hematologist focused on clotting and bleeding disorders, and really focused on raising awareness and attention for people who have rare hematology disorders, including hemophilia B, but also all the other rare hematology disorders like autoimmune hemolytic anemia and ITP. And I wound up finding myself interested in expanding access across the country. Turns out there are only about 300 benign hematologists in the whole United States. So by expanding access and expanding to telemedicine access, I've been able to bridge the gap for people who need access to benign hematologists.
Interesting. And you speak with patients from across the country, given that you are telemedicine. Why are people with hemophilia B seeking second opinion telemedicine consultations? Why is that happening right now?
There are several reasons. One is that they want reassurance to know that the treatment they're getting is reasonable. And this spans the range of people who have severe hemophilia B versus those, and also those who have milder hemophilia B that only need intermittent treatment, or maybe they just need to know about treatment options. A whole separate reason for people to seek a telemedicine hematology consultation is that they don't really feel connected with their local HTC or their local physician. A lot of times they're seeing a hematology oncology provider who's not quite the expert at hemophilia that the patient is looking for. Now, and important to realize that there are now several treatment options for these patients, and they're just looking to get information from whoever can provide it, from an expert who at least can explain the treatment options.
And do you find in general, are patients looking to change treatments, or are they mainly seeking reassurance that their current treatment is appropriate?
It's both. So change treatments, sometimes we find people who are just not on any treatment and they're looking to start something and figure out what there is for them. And it's partly this disconnect that they may have with their current provider. But those who are actually on treatment are looking to find out whether they can be optimized, whether they're doing the best thing that they can, and sometimes looking to at least explore other treatment options.
And we've seen remarkable advances in hemophilia B treatment over the last decade. From your purview, what's changed the most?
Yeah, the top thing is the extended factor products. That's really changed the world for all the hemophilia, all the bleeding disorder patients, hemophilia A and hemophilia B. Extended half-life products, which came simultaneously with gene therapy, have made it so that patients can have a better quality of life without joint bleeding and living on prophylaxis. Now, it's not perfect for everybody, and it turns out it's not fun and games to do self-injection and have, even with extended half-life factor products, but it has definitely made life better and probably prolonged the lives, and definitely prolonged and improved the quality of life for patients with hemophilia B. In addition, gene therapy has finally come of age, and gene therapy is now an option for selected hemophilia B patients, offering the potential for a sustained increase in factor IX and to possibly come off of all factor treatment. It's not an option for everybody, but it's becoming more widely appreciated, and it's something that's worth talking about.
I agree. It is worth talking about, Dr. Fine, and I'm going to use that as a cue to take a moment here to remind listeners about Zebra for Care. So if you're living with hemophilia B and want to better understand whether you may be a candidate for gene therapy, Zebra for Care offers a free online self-assessment designed to help you prepare for that conversation. After completing the 5-minute assessment, you'll receive a personalized report that you can bring to your next visit with your hemophilia treatment center or hematologist, helping make that shared decision-making conversation even more productive. You also have the option to share that assessment with Dr. Fine and his colleagues through Amplify MD to request a second opinion consultation. Now, for me personally, getting a second opinion was an important part of making a major health decision regarding ankle surgeries I needed from years of damage related to my hemophilia. The second opinion is what gave me confidence that I understood my options and was making the decision that was right for me. And that's really what Zebra for Care is all about, helping people with hemophilia B feel more informed, more prepared, and more confident as they navigate important treatment decisions. So to learn more or complete your free self-assessment, visit hematology.zebraforcare.com. Again, that's hematology.zebraforcare.com, or simply follow the link in this episode's show notes. Okay, so Dr. Fine, back to you. I want to ask you a question about these treatment options and their availability. I just mentioned shared decision-making. How do you, on your side of that conversation, come to decisions, conclusions about which treatment option is right for a particular patient? What information are you using to come to those sorts of decisions?
Yeah, it's more complex, but also so much more rewarding now because we have options. And there isn't a single best treatment option for everybody. We have to look at all the factors. We look at all the issues, rather, factors, pun.
No pun intended, of course.
So we look at the history of bleeding, the history of compliance and ability to get clotting factor and prophylaxis and to maintain good quality of life on factor. We look at the actual factor levels. We look at the patient's history of joint challenges, joint problems, joint pain, their age and activity level, whether they want to be active and do sports and activities, whether they want to actually be able to work out and do exercise, whether they travel, their ability to get treatments if they actually are mobile and don't stay in the same place to have them access to their treatments coming to their home. We look at their personal goals and what they want to achieve on treatments and whether they're looking to try for a treatment option like gene therapy that might be a one and done versus their contentment with extended half-life treatments. We like to expose people to all their options, including a discussion of gene therapy as an option. Now, no two patients are identical. Everybody's got a different profile of their needs and patterns and desires and ability to get access to different treatments. That's part of the reason for the whole shared decision-making concept, to be able to go through this in detail with the patient. And we do this online, just to be clear about the telemedicine. So it's a second opinion as a telemedicine appointment. So it's not traveling. They see us from the comfort of their own home, commonly with their family, either next to them or on the same call, like a video call. And commonly evenings or even weekends that we do this. And we're able to give the second opinion and go through all this.
So speaking of telemedicine, how would you say telemedicine has changed access to expert hemophilia care?
The main thing is it's changed access to actually seeing a hematology provider, which is myself as a physician. We have many APPs, nurse practitioners and physician assistants doing this together, and others who are pertinent to this. And the access to seeing and talking to somebody, because really all this starts with conversations and education. And you don't need to travel 20 or 50 miles or longer to actually just have a conversation with an expert. Now, that's the telemedicine world we're in. And we're way into this world. This is not new anymore. We've been doing this for now many, many years. We see you online. It's just like a regular doctor visit, but it's online without physically going to the doctor's office. And commonly we're on time without making you wait too long. We try to be. And that's not easy, but we try to be so that we don't make you wait too long to see us, and make it so you can get seen faster. You don't need to wait months to get an appointment. So that's the revolution of telemedicine for hematology. Hematology turned out to be one of the best specialties in medicine for telemedicine, because most of what we do is reviewing your situation and doing education and even showing you some things online. We can share a screen and show you your numbers and go through your test results and other things online. So hematology is very telemedicine friendly. When it comes to actually getting the treatments, our team has connections with pharmacies, and we know how to access the pharmacies, and we know how to have things sent to you. So just hemophilia B patients are aware of having treatment sent to them. That's something that we're in the mix with, and we're able to help out with that. So you don't have to physically go somewhere to get things sent to you. And when it comes to gene therapy, that would be a referral to a gene therapy expert and physically going there and getting the treatments.
Makes sense. Dr. Fine, some patients might worry that they'll offend their doctor if they seek a second opinion. What are your thoughts on that particular concern?
I view it the opposite. I think that most hemophilia providers and doctors are happy to be part of the larger picture network of discussion and education about hemophilia. And it shouldn't be viewed as that we're stepping on anyone's toes or that you're going to offend them. It shouldn't be viewed that way. Yes, it's true that some doctors do get offended. And I think we second opinion providers have to be careful that we don't step on their toes. And we explain to you how you can talk with your other doctors about you got a second opinion. So what? That's a common thing to do in medicine when you have a challenging problem. Now, we're finding that most of the patients who come to us are not thrilled with their current doctor or their current situation. So it's not so much about stepping on toes of someone that you trust. Oftentimes it's actually just getting another opinion and possibly getting another provider long-term. It's all about you, the patient, to get the confidence that you need to make well-informed decisions. And it's not only your right to get a second opinion, but also something that will empower you and make you feel better about everything.
Speaking of patient empowerment, Dr. Fine, we've discussed shared decision-making a little bit, but when thinking about an important healthcare discussion between a patient and their physician, what can patients do to prepare for those moments? They're so important. How can patients best prepare for them?
Yeah, they should be comfortable with the kinds of questions that we're going to be asking for a hemophilia patient. What's your bleeding situation? Have you had a breakthrough bleed? Maybe try to document it and keep a diary in your phone even, just so that we can have an easier discussion about it. So you're not thinking back, did I have a bleed or not? Think about the pain level that you have and what joints are hurting. Think about whether or not this is interfering with your daily life and your quality of life. And you should be able to have an honest discussion about what treatments you have had success with, how well it's gone, how easy it is for you to actually get the treatment, how challenging it has been. Would it make a meaningful difference to you to get onto extended therapy or to try to have a discussion about gene therapy so that you can have a one and done and no longer need this infusion therapies? And so be prepared with the right questions. Be prepared with kind of, I would say, a diary of what's gone on with you the past month or 3 months so that we can have a better discussion about it. And the other thing to be prepared for telemedicine for me, for the way I see it, is that this should be a recurring thing. So it shouldn't be like a once a year check-in. Telemedicine makes it easy to do an every 3 or 6 month check-in if you were to stick with the telemedicine team and not be a single second opinion appointment. So just to point out that we can do that a little more easily to do a frequent appointment without having to drive to us, and we can see you every 3 or 6 months. And I think that gives you a little more stronger bond and relationship with the team, which not just the second opinion team, but a care team that's online.
And Dr. Fine, you mentioned coming in prepared with questions. I think sometimes for patients, it can be hard to know what questions to even ask their healthcare provider. And sometimes I know in my experience, those moments can feel intense or overwhelming, and I can totally lose sight of what was previously on my mind. How do you advise patients on how to come up with the questions that they ask their provider about new treatment options?
The questions are, will these new options be appropriate for me? Or are they appropriate for me? Are there benefits that I can expect to receive by taking a new treatment option that would outweigh any risk or problem or challenge with them? So do the benefits outweigh the risks? How will this possibly improve my quality of life? A big question is, do we know the long-term outcome or effect of any of the new therapies? Is there any problem that we anticipate down the road? And then another question is, what kind of monitoring will I need to be on? As an example, gene therapy, we know we have to do a liver enzyme test every so often just to double check that there's no problem with it. So we do that. And that's the kind of question you want to ask. Is there any monitoring that I need? And how frequently do I need to have a check-in with any of the providers that are involved? And finally, the opposite. If I decide to stay on what I've got, if I stay on my current treatments, is there anything that I need to do differently? Am I optimized for what I'm currently doing? So these are the kinds of questions that should be asked, and you should be prepared to ask your provider, either a second opinion telemedicine provider or your primary health HTC provider.
That was a really helpful list. And before this last question, I'll just again remind listeners, if you're interested in gene therapy for your hemophilia B, I strongly recommend that you take a look at the Zebra for Care platform, hematology.zebraforcare.com, or follow the links in the program notes for that free self-assessment that could also lead to that second opinion. So, Dr. Fine, before we wrap up, is there anything that we haven't covered with respect to hemophilia B, telemedicine, or anything related that you'd like to share with the listeners?
It's a different era. Year by year, things are improving in terms of access to care and access to telemedicine. Now, our practice has the only nationwide telemedicine hematology coverage, so we can see you anywhere. I think the key is to stay engaged. So my one message is to stay engaged, have that relationship with your provider, whether it's the HTC locally or a telemedicine hematology provider, and stay on top of things, because we know that by being engaged and being a participant in your healthcare, you're going to end up feeling better about things, and you also possibly live longer and better with your disorder.
I think that's a fantastic place to leave it. Stay engaged. Dr. Fine, thank you so much for your time today. It's been a pleasure speaking with you.
My pleasure. Thank you.
Thanks again, Dr. Fine. And thank you, Nathan, for joining the show today. We appreciate you both.
Thanks as well to our presenting sponsor, Takeda, bleedingdisorders.com for more. We could not produce this show without your support, and Amy and I are grateful for it. All right, Amy, speaking of you, I guess, our next episode comes out on the 14th of August. What can the listeners expect to hear?
We have another Zebra for Care segment, which I'm excited about. These are great, and it's a phenomenal resource, so I'm looking forward to you guys hearing more about that.
Fantastic. Well, with that is all for this episode. But be sure to subscribe to the BloodStream podcast wherever you get those podcasts to make sure you have the next one delivered to you the moment it goes live.
And y'all, as always, email us at mailbag@bloodstreammedia.com to inquire about podcast or video or film casting, to share your story, and just to reach out if you have a topic or a guest that you think would be great on the show. We would love to hear from you. You can find us on social media, me and Patrick and all the things. Bloodstream Media, Believe Limited, Dismissed the Film, we're everywhere.
We really are. I am your host, Patrick James Lynch.
And I am your other host, Amy Board.
And until next time, take self-care of yourself. Bye, everybody.
Bye-bye, y'all.